All right, we're here with Dr. Nazari, a dentist from Houston, Texas. Hi, Dr. Nazari. How's it going over there?
Oh, very good. How y'all doing?
Not bad. Dr. Nazari, let's talk a little bit about children dentistry. Your office does provide children dentistry, right?
Yes, we do have provide children dentistry.
Yeah. And tell us, what can you tell us for moms, parents who, have that baby, maybe the firstborn, maybe not, because they might not have done it the right way with the first baby. What should they pay attention to? When should they start coming to the dentist with that baby? What should they do and not do at home with the child? Can you shed some light on that?
We like to see the kids, the children, as early as the parents can bring them. Even while the parents are expecting a baby, we like to see them so we can educate them as far as how to care for the children's teeth before even the children are born.
Wow, that's early.
Yes, yeah, very early. So they would know what to expect with kids, and we usually see kids, and even from age 3 months and above. And when the parents come in, we show them that how to clean the gum after the baby is breastfed, or they have baby food, or the milk that they get from the pharmacies. So we show them and we teach them how to clean the gum with a little 2x2 gauze to clean that. And after the baby's teeth are erupted, we show them that how to clean those properly, and educate them as far as how to care for the teeth. We tell them that never let the baby sleep with the milk in their mouth, because that causes baby bottle decay. And also after they breastfeed or they give milk to the baby, we ask them to make sure they burp the baby so they can swallow all the milk, nothing left in their mouth. And after the patient, the children or the kids are finished with their meal, we ask them to wipe the teeth immediately, either with a wet 2x2 gauze or small soft toothbrushes that we provide for them from the office.
I see. So even before the baby did I get this right? Even before the baby has the teeth, the gums should be cleaned, they should be touched. Is that to make the baby getting used to it, or is that some other purpose?
Well, it's just a part of the hygiene protocol to keep the mouth clean, because when you drink the milk and if it is in the mouth, the baby can develop thrush or some other kind of fungal infections. That's part of the overall hygiene, and also the children would get used to brushing their teeth and taking care of their teeth and their oral cavity or the mouth.
Mm-hmm. That makes sense. And then, so once the baby is born and the baby comes in very, very young, I assume there's really no work to do, and that's probably part of the purpose, so that you just kind of, for all purpose, it looks like play to the child, yet you see a little bit what's going on, and just in case something is not right, put attention to it. But like the baby gets used to again to be at the dentist, is that part of the reason? Because I can't assume that a baby has all that much work at whatever couple of years old or so.
These are just preventive measures. These are all preventive measures, and to get the kids getting used to proper home care, and also get used to coming to the dentist on a regular basis, so we don't have kids going through traumatic experiences sometimes they have when they come in with badly decayed teeth. These are just preventive measures.
Mm-hmm. And as you said, the teeth can decay rather badly if a child falls asleep with orange juice or milk, even if there's no sugar in it, because it's acidic and sugary anyway, regardless of whether you put some extra in it. And that's like soaking the teeth in. We adults, we learn that we should brush after every meal, or at least before we go to bed. And so sleeping with a bottle of milk would be just the opposite, would be soaking it in the juice and the case heavy. But let me ask you, so that's what you show them and tell them not to do, and because otherwise their teeth will decay. So let me ask you, what about children who do thumb sucking or don't want to get rid of their lollipop, is there any dangers, anything parents can and should do? Or doesn't it really matter? Eventually the child will stop thumb sucking and it's no big deal. Or is it a big deal?
Well, at the beginning, the first couple of years, I personally don't worry about it. It's just part of the habit of the kids. But after 2 or 3 years of age, if that continues, it can cause defect in the growth of the upper and lower jaws, which is maxilla, and then the mandible. So after age 3 or 4, they need to consult their dentist that what measures they can take in order to get the children to stop that habit. Sometimes they'll have it because of the psychological problems that they're experiencing, or sometimes just a habit that they have developed throughout the past few years.
Mm-hmm.
But we do those kids that they don't stop by the time they go to school. You can see the what we call it open bite cases. The front teeth do not bite together because the thumb or the tongue has been there for so long, so those teeth do not meet. And then also the kids can develop crossbite in the back. It means that the upper arch is narrower than the lower arch, maxilla versus the mandible. So they're going to need orthodontic treatment when they get older. So we like to stop this as soon as possible. When they're going to the first through 5th grade of elementary school.
And what are some of the things you can tell the mom to stop? What are some of the stuff you tell them if that happens? What can they do?
Well, we ask them to observe them and see that when the kid when the child does that, when they is it just unconsciously try to remind them by encouraging them to stop that, and then we don't want it to be forceful. We don't want them to punish the kid because of those habits. We just want to get the positive reinforcement from the parents to the kids, and then when they just educate the kid and keep reminding them they should not be doing that. And that doesn't work, then we have to resort to some kind of appliances that dental offices or orthodontic offices can fabricate for them to stop those habits.
I see. All right. Okay. So it is a concern if it lasts too long, if a child is thumb sucking or doesn't want to get rid of their lollipop, and then
yes,
it could. All right. So
usually if we catch it. Usually if we catch this at early stage, and then if there is any deformity developed, by stopping the habit, that deformity can resolve itself on its own.
Okay, I see. So basically parents should pay, around 2.5 years old, they should start telling the child, come on, this you shouldn't do this, and maybe explain it. The child will probably not get the real why behind it, but at least tell him, look, don't do it, or whatever. Gently take their hand out of their mouth continuously so that they just stop doing it.
Yes.
All right. Good. Well, wonderful. Thanks for the information, Dr. Nazari. I'm sure it's helpful to some people out there, especially like young moms and dads, because sometimes, we'll get concerned about all kinds of little things. What shall I do now? All right, thanks a lot. Bye-bye.
Thanks, sir. Bye.